Alright, so recovery time post-op video, I guess. I usually do these after most of my surgeries, and I haven't done one yet. So obviously my voice is still a little harsh from having the tube in my throat, and to be quite honest, after waking up from the surgery in the hospital bed, I was a bit confused as to why I was staying overnight. So if you've watched my Instagram or my Facebook post, you'll know that I had surgery. It was supposed to be a medial femoral patella ligament surgery, basically an arthroscopic surgery to go in, replace the ligament, and bring my kneecap back to where it should be. Unfortunately, as I was falling asleep in the operating room after getting the anesthesia, they were setting up for x-rays, and it turns out that genetically my kneecap was just completely messed up, which is not much of a big surprise for me because my mom, I'm not really sure, but I'm pretty sure this is the type of surgery she had back in 1978 where she had both of her knees done because her kneecaps went way out of whack. And so I'm not particularly sure, but neither my mom or her parents are around anymore to actually tell me anything about the surgery. But so what they basically did is they used a Fulkerson procedure, which I later found out, and they went in and they sawed part of my tibia and kind of brought it back together along with my patella. And so now I have about a 3 to 4 inch incision down my knee. So surgery was Wednesday. Today is now Saturday, so about 3 days. And as I said here, the pain is a lot less. I'm able to get up and go to the bathroom by myself. For the last, let's say, day and a half, I was using the walker to go to the bathroom and then the crutches into the bathroom because my bathroom is very small. But I realized this morning that I can use the crutches a lot more, but I was so afraid of the crutches is why I use the walker around. But if I go outside anywhere, I may use the crutches. I said the hardest part right now, obviously, is just trying not to bend the knee. I do have the surgical wrap on it. I'm going with the ace bandage, and then I have an immobility brace on, so it goes from the top of my thigh practically all the way down to my ankle because I am a small person. So laying here on this couch can be a bit boring at times, trying not to bend the knee, but I know that in the long run, for me physically, this will be better for me. I can get back to fitness, but it probably won't be until probably about May or June, because that's when they say it takes for the recovery of bone about 6 months. So I'll just be happy to hopefully get back to some sort of a normal resemblance, which I haven't done since 2017. But all these surgeries in the last year and a half to almost 2 years now has been more to better my life and to better, my outcome or outlook on life. I'm gonna say the medication is still in my system to make me talk the way I talk right now. But I do have crazy doggies who have been watching me and steering clear of any contraptions I use. Daisy still tries to climb up and take care of me as she would because she is my service animal. George is just pretty much frightened, as she normally is. But they are both watching out for me while Mom's at work. And I do want to say thank you to my amazing wife because it hasn't been easy with all the multiple surgeries I've had the last couple of years. And to find someone like that to love you no matter what and to be there for you, that's what you want. So hopefully you guys find someone like that, because once you do, never let go. So day 3 post-op, I'm actually able to hold down food. I'm able to go to the bathroom by myself, and minimal pain. That's about it. All right, bye guys.